Welcome everyone to our presentation. Today we will be talking to you about early childhood educators burnout, a systematic review of determinants and interventions. Here are our contact details. I am a research project coordinator at AERO, Australian Education Research Organisation, and I'm currently a student at Macquarie Uni. My co-author, Dr. Marg Rogers, lectures at the University of New England, and Dr. Courtney McNamara, who's unable to be here today, is a lecturer in public health in the University of Newcastle.
Okay, so the current state of early childhood education in Australia, the 2019 ASEQA Workforce Report confirmed that administrative cost of education, recruitment, induction and training is exacerbated by a high staff turnover within the sector. Early childhood educators are feeling stressed and concerned about their well-being and their burnout. The unrecognised emotional burden of caring is not being compensated financially and not being factored into the workload that early childhood educators face. Teacher burnout is detrimental to children's education because they are less able to interact positively with the children and unable to be as energetic as they might be when they are burnt out. And it also creates associated turnover. Considerable training and replacement costs to educational systems is also a financial burden that we are all paying in our taxes. In this systematic review, we will be looking at ECE service-related determinants or factors that cause burnout, and also individuals' burnout likelihood or factors, and the effectiveness of some of the early intervention, alternate interventions that have been tried.
Now let us have a look at how our systematic review addresses this gap in research. As in all systematic reviews, we started off by identifying the PICO, as seen on this slide. As we searched the current literature, we found that there is an existing body of research that was looking at the primary and secondary school educators burnout, but there is little is known about early childhood educators burnout. So drawing upon two existing systematic reviews that examine burnout, as you can see here on the slide, we operationalized keyword search for burnout outcomes, and that included stress, burnout, quality of life, or anxiety. And for educators, we included early childhood educators, early educator, or preschool teach. And for the early childhood services, we looked at early childhood, preschool, or kindergarten. Next, we were guided by the Prisma diagram, as you can see here, as a protocol to the identification and screening process. So we searched two databases, the Web of Science and Progress for articles on burnout and early childhood educators. 1,168 articles were suggested as potential records from our search. After abstract and title screening, 948 were relevant for full text review, and 39 met the inclusion criteria for the systematic review. Now referring to the left column, articles were excluded if they were about poor existing physical and mental well-being instead of the role requirements, and they were included if they were peer-reviewed, written in English, about early childhood educators, and working in center-based services.
So the findings, the focus of the studies, 37 out of the 39 studies investigated the causes of burnout, and 2 researched interventions to prevent burnout. The methods of the study, 34 studies were quantitative, 3 were qualitative, and 2 used mixed methods. All 3 qualitative studies were phenomenological. The types of study, 34 were cross-sectional studies and 5 were longitudinal. The distribution of the studies in the continents, most were from North America, then Europe, Asia, and Australia. And you can see there were none from South America or Africa. So the tools, a Matchlex burnout inventory and different quality of life measurements were used. The identified causes, 9 at the individual level and 23 at the service-related level, and 5 at both individual and service-related levels were found. So the implications, so considering the relationship between teaching years and the numerical age, the educator age and the age group they teach, stress and gender, and the multiple family loads and their impact on educators' expectations of employment, terms and conditions.
Next, 59% of the studies in the systematic review reported burnout determinants at the service-related level. Of these service-related determinants, poor organization structure recorded the highest number of studies, with burnout factors such as high job demands and a lack of resources, lack of clarity of role, mismatched roles and expectations, and excessive work expectations. Poor professional relationships ranked second in accounts of reports of educators burnout under the service-related level. Poor professional relationships is characterized by the lack of collegiality among co-workers, the lack of support from supervisors, enduring challenging behavior of children, and poor parental support or acceptance. Now, as seen on this slide, other burnout determinants at the service level includes low professional status and work progression, lack of professional training in combating burnout, and the lack of staff well-being focus. So what are the implications? At a service level, which includes this includes providing adequate resources and support as they impact on educators' role and well-being. And it is also important to note that higher work expectation on more experienced and qualified educators leads to burnout. Last but not least, only 5% of the systematic review were on educators' burnout intervention studies. This low number of studies is exciting as it signals beginning interest in early childhood educators' burnout, but also alarming at the rate actual intervention studies are happening to combat the issue. The first study in US by Roberts et al. 2020 investigated the effects of online professional training in buffering risks of burnout. 89 teachers were randomly assigned into 4 groups, namely effective classroom interactions course, which is run online, coaching condition, reflective writing condition, and a control group. The study found the US participants in the control groups that included elements of coaching and reflective writing reported benefiting from the availability of emotional outlets and or opportunities for feedback, highlighting that some professional training approach is more effective than others. In the second study, it is found that workplaces with a well-being focus were able to significantly mediate the effects of burnout. 324 Italian preschool teachers were placed into 3 treatment groups. First, in a psychological treatment group, teachers were provided with counseling and support meetings. And in a second psychosocial treatment group, teachers were provided with physiotherapy, speech therapy, gymnastics, and vocal hygiene. Finally, in the last physical treatment group, teachers experienced a redefinition of their work environment where they were invited to adapt and change over workplaces and furniture in consideration of the aging employees' physical needs. Results of this intervention found that the psychological group provided with counseling support enabled educators to understand their work better and reflect and recover, and hence revitalizing and motivating them for work. Having outlined the findings in this systematic review, let us look at the discussion of our studies. Now, against popular belief that burnout and well-being belongs in the individual domain, our systematic review is highlighting factors that are showing a higher association of educators' burnout in the organization domain. In the individual level, where low wages, poor health, low social capital, and demanding roles were named as factors of burnout, it is interesting to note that the age factor, namely the youngest and the oldest educators, record the highest burnout. This indicates that more support may be required at these two ends of this teaching career, as signified by the age, to improve their well-being so as to keep them in the profession.
Okay, at the service level, poor organisational structure and professional relationships were found to be associated with the highest service-related burnout determinants. Poor organisational structure included unrealistic organisation expectations, time pressures, meeting children's and personal needs, and dealing with non-teaching tasks, which all increased feelings of burnout. Poor professional relationships were reflected in unresolved conflictual relationships with directors, their colleagues, the children, and challenging behaviour, and parents, which can also lead to burnout. So in conclusion, educator burnout is rife in both schools and early childhood settings in Australia at the moment. Our findings are consistent with other studies which found workplaces that focus on staff wellbeing with adequate resources, training and relational support were needed to avoid educator burnout. Educators need to reclaim time and space to interact with children and concentrate on their personal wellbeing. Professional training in emotional strategies as key job expectations need to be also provided. Emotional exhaustion that results from exposure to negative workplace environments and conflict caused by mismatched roles and expectations that need attention. Educators are looking for meaningful work with recognition of professional status and reasonable financial reward. Implications of this study for practice and policy include the considerations of further work contracts and positions, and they should take into consideration the family roles, gender and age, as educators with multiple family roles are more likely to carry the mental and physical load involved in managing a household while also engaging in paid work. And we hope you've enjoyed our presentation today, and please contact us if you have any feedback. And there's all of our references. Thank you very much.
Thank you.